Cambodia has one of the highest child mortality rates in the region, with most deaths occurring in the neonatal period. To combat this, People in Need, with technical support of Cambodian NGO Open Institute, started the Village Baby Care Service in 2013, a system that makes automatic phone calls to mothers who have just delivered a baby. The service sends 7 calls to mothers during the first 28 days of the baby's life with pre-recorded information that is important for their health. The messages were carefully developed to ensure that they project the correct amount of authority to build trust, as well as the correct amount of empathy and metaphors so that the audience would absorb the information and act on it. A controlled evaluation of the service showed 2/3 of mothers stopped using unhealthy traditional remedies to treat their baby's cord stump. 33% fewer babies experienced episodes of diarrhea with fever, and visits of newborns to health centres increased by more than 2.5 times. The evaluation also showed that most mothers remembered the messages, acted on them, and shared them with other mothers. People in Need has now developed new messages that cover the first 1,000-day period from conception until the child is 2 years old. Currently, health centres are starting to use tablets to collect information on their patients. This information includes the phone numbers of mothers who deliver babies, as well as a consent question to receive phone calls. This information is expected to be integrated into the automatic calling system to streamline and scale up the registration process. The current project enrolls about 10,000 mothers a year in one Cambodian province. With additional funding, the target is 160,000 mothers in Year 3 and 320,000 in Year 5 and beyond, or about 90% of all births in Cambodia. Our evaluations have shown that mothers wish to have a longer service with more messages, and that over 80% are prepared to pay up to 50 cents per month for receiving these messages. The value they place on the service and the willingness to pay enables the development of sustainable agreements with phone operators, in which the calls will be free for all mothers during the first 6 weeks and paid through telephone credit after that. Our goal is to reduce neonatal and infant deaths in the coming years by at least 30%.